How do nodules form? The etiology of nodules is complex and related to the type of disease. It generally includes inflammatory and non-inflammatory types. Inflammatory ones are mostly caused by pathogens such as bacteria, fungi, and viruses. May be secondary to metabolic diseases or tumors. What are the causes of nodules? Inflammatory factors are mainly due to bacterial, fungal, viral infection, and parasite invasion. Diseases related to nodules may appear, such as leprosy, sporotrichosis, skin cysticercosis, syphilis, etc. Non-inflammatory factors include vascular diseases such as granulomatous vasculitis, histiocytosis such as lymphocytoma of the skin, metabolic diseases such as xanthomatosis, pulmonary infectious chronic granulomas such as sarcoidosis, autoimmune diseases such as rheumatoid arthritis, etc., are partly related to the accumulation of metabolites. And some nodules are still a new organism, which may be related to tumors. Lung nodules are not necessarily cancer, and many diseases may cause lung nodules. If the pulmonary nodules cannot be diagnosed clearly, the changes of the nodules can be observed after about 3 months. Pure ground glass nodules have a good prognosis, and regular follow-up observations can be maintained if no significant changes are seen. Some mixed ground glass nodules that have no obvious changes after observation do not require special treatment, and follow-up is repeated every year. For nodules with early malignant morphological changes such as enlargement, solidification, and burr signs, it is up to the doctor to determine whether to perform surgery and other treatments. Breast nodules. For benign nodules, regular review and follow-up should be performed without special treatment. For nodules that cannot be clearly defined as benign or malignant, a needle biopsy can be performed to clarify their nature based on the results of pathological diagnosis. It should be noted that when a patient finds that he or she has a breast nodule, if the condition is unknown, it is forbidden to rub the nodule at will, so as to avoid adverse consequences such as promoting the metastasis of a small number of breast cancer patients. Thyroid nodules. At present, ultrasound is the first choice for screening thyroid nodules. Most patients often find nodules during physical examination. If they are initially judged to be benign, it is generally unnecessary to undergo biopsy, CT, and other examinations. In general, benign and malignant nodules do not transform into each other. Definitely benign nodules should be re-examined once a year. If there is no obvious change, the re-examination cycle can be extended to 2 to 3 years with the course of the disease. Everyone should pay attention to that once a thyroid nodule occurs, it is unlikely to be reduced by oral medication. Therefore, after a nodule is discovered, please do not blindly use drugs or health products to eliminate the nodule, to prevent damage to your health. I especially recommend a deer antler hat that has been passed down for thousands of years and has been eaten for many years. If you don't understand, you can Baidu antler cap powder, also known as deer tray powder, the best anti-inflammatory drug on the ancient battlefield, is often used to dissipate unknown nodules, tumors, lumps, and foreign bodies in various parts of the body. The antler hat can warm the kidney and tonify deficiency, remove blood stasis and detoxify, reduce inflammation and relieve pain, strengthen tendons and bones, promote blood circulation and reduce swelling, lower milk and dissipate blood stasis, warm and invigorate spleen yang, treat impotence and spermaturia, consumptive internal injuries, pain in the back and muscles, swelling and pain due to blood stasis, breast abscess at the beginning, breast distending pain, milk retention, gangrene sores, mastitis, mammary gland hyperplasia, breast cancer, lymph nodes, ovarian cysts and other gynecological diseases, as well as pharyngitis, colitis, proctitis, gastritis, mumps, lymph nodes inflammation, pneumonia, cholecystitis, pancreatitis, prostatitis, thyroid nodular hyperplasia, and uterine fibroids all have a good adjuvant treatment effect, super anti-inflammatory, and calcium supplementation.